Telehealth means that we can deliver healthcare to patients how they want it, when they want it, and where they want it. Telehealth means that we can extend our reach to people who might need care but can't access it. I think that the benefits from telehealth in the patient's home, the sky is the limit. I mean, I think we have gains. We have gains for our patients in terms of efficiency and time. We have gains in terms of cost savings. I can't tell you how many patients actually ask to have this service because it can be really challenging to arrange for rides, pay for transportation, parking, all of those things. So I think it really is of great benefit for our patients. I absolutely feel like I can connect with patients during telehealth visits, but I do understand why people would feel like I want to see my doctor, or doesn't my doctor need to touch me or do an examination? And we have found a lot of creative ways to be able to do that examination without actually being in the same room with the patient. As we all know, we can use our phones to have FaceTime with our friends, and so we know what that's like. And a lot of visits in medicine don't necessarily require you to see a patient in the same room. So we can go over labs, we can look at imaging studies, and we can do all those things through telehealth. It's intriguing to me why a patient wouldn't want to use telehealth, because a lot of the patients who ask me about it have a lot of really good reasons why coming to the clinic is challenging for them. So I would think that a patient would want the ease of the visit. They could do it in the comfort of their home. They wouldn't have to deal with the cost and the hassle of the transportation. And then for some of our patients who live in really remote areas, we're able to bring a level of expertise that that community might not otherwise be able to support. So I think that telehealth is perfectly utilized in the smaller and lesser resourced community, because that's a community where we may not be able to get to in person. That's a community that's going to have the hardest time coming to Virginia Mason. That's the community that's going to have the hardest time coming to a clinic. So we're hoping to be able to provide that high level of clinical expertise to a community that might not otherwise be able to support that kind of a practice. The telehealth technology has changed completely. It's become so easy for patients to use. So you can either get a text or an email, or you can access the virtual clinic online, and then you are right there in your video visit. So I would tell a patient who might feel apprehensive about it to give it a try, because I think that there are a lot of settings where we could have a really effective and meaningful visit, and it might even be, fun to connect that way as well. So I would say definitely give it a try.